And being a pharmaceutical company, very scientific driven, we wanted to replace one empirical measure, sales, for another empirical measure. So what we did was we created this really bulletproof scientific scheme that had 10 or 12 elements to it, scientific knowledge, selling skills, various assessments, and quite a detailed but very, very empirical approach. And guess what happened? It was super complicated. Our sales representatives weren't quite sure what they needed to do to be successful from a Salesforce incentive perspective, and we ended up losing a little bit of our competitive edge, I would say.
First of all, you cannot replace the objectivity of a sales ranking table. It's impossible. If you try and do that, you get enormous complexity in your organization. So our first markets who went live with this system really tried to replicate that level of objectivity, and we saw complexity. We saw over-testing of representatives, very complex evaluation forms. So you're never going to exactly replicate it. So you have to accept a level of manager subjectivity.
The brand went from third line to first line in about 2 years, which you could say is good. Honestly, I think it could have been even better, because fundamentally we missed the first line sales managers. We didn't really get them engaged on how to coach on productive questions. We coach the field force, and I believe you need both to really get the substantive change that we need that can be repeated again and again.
As we put our strategies into the market, our customers start to react to them. And some things don't resonate, and we need to adapt. We need to ensure our markets are enabled and capable of finding solutions. And we need to make sure that we can harness that innovation and leverage it so we can integrate it, so that the strategy we ultimately deliver has meaning and impact.
When we introduced this idea, the impact it had inside the company, do you think that people said, well, wow, that's an amazing idea, let's do that? Or were people afraid? They were very much afraid, because they were afraid that, look, one of our core competences in the company is our models, is our ability to predict whether a molecule works or not. And now we are just sharing that for free with anybody.
We actually have a lot of our general managers here in Barcelona this week, which has been great for them to see what all our competitors are doing. But they're actually spending some time together as a leadership team, looking at how they're going to lead and drive the change for our business as well.
I'll be the first one to say that by many respects, we've been sort of scratching the initial surface in terms of the opportunities we've been able to capitalize on. Impacting outcomes. We do have quite encouraging data for a number of the solutions that I will share with you. But a lot of them up until now are really proxies, right? So increased or enhanced health literacy leading to improved adherence and, as a consequence, theoretically improved outcomes. It will be really upon us as an industry to actually demonstrate to key stakeholders that outcomes are in fact improved, and that this is just much more than the so-called flavor of the day.